In this video, we'll talk about the different drugs used in order to treat Alzheimer's disease. They don't actually reverse the disease, they are used in order to ease the symptoms. The US Food and Drug Administration has approved 5 medications which work based on 2 different mechanisms: cholinesterase inhibitors and memantine. I'll talk about the first method. Nerve cells communicate in the brain by releasing neurotransmitters. Acetylcholine is an important neurotransmitter for learning and memory. People with Alzheimer's disease have low levels of acetylcholine in the brain. Cholinesterase drugs inhibit enzymes called cholinesterase from breaking down acetylcholine when it is at the synapse. The resulting higher concentration of the neurotransmitter could lead to increased communication between the nerve cells, and therefore stabilize symptoms of dementia by delaying the worsening of the symptoms for about 6 to 12 months according to the Alzheimer's Association. Now I'll talk about the second method of drug use. Glutaminate is another neurotransmitter which sends messages related to learning and memory. The attachment of glutaminate to the cell surface receptor called NMDA receptor allows calcium to enter the cell. In Alzheimer's, there is an excess release of glutaminate from the damaged cells. This will lead to chronic exposure to high levels of calcium and therefore further cell damage. Memantine is an NMDA receptor antagonist, which means it will block NMDA receptors, protecting the brain cells from the effects of excess glutaminate. This drug produces effects similar to cholinesterase inhibitors. It delays worsening of symptoms for some people temporarily. It is important to notice that the effect of both drugs vary for different people, as it can produce also side effects. Common side effects include diarrhea, nausea, vomiting, muscle cramps, lowering blood pressure, insomnia, fatigue, and loss of appetite. And those are the treatments for this disease currently approved by the FDA.